Okay, so how you guys doing? Everybody okay?
Yes.
Very good. So this next skill is foot care. Okay? Foot care. On the state exam, they could ask you to demonstrate foot care, to show foot care. Okay? So let's follow the direction. On suit direction ensemble. Okay? So the first thing is perform hand hygiene. Well, first of all, before you perform hand hygiene, make sure you understand what they ask you to do. Rassurez-vous qu'on bien comprendre ça demande pour performer. Okay? Mr. Jean, I want you to perform foot care on one foot. Okay? So I ask to repeat. Can you repeat for me, please? I want to make sure I hear it. Okay? And then I'm going to say it back to them. So you want me to perform foot care on just one foot, correct? Okay? So you demande pour faire foot care. Ou demande pour répéter le bas pour sûr qu'on bien entendre. Troisième lieu, ou répéter le back by you. So you want me to perform foot care. Okay? Very good. All right. So before I perform foot care, right? My beginning steps, right? Good morning. My name is Jean. I'm your CNA today. I'm going to do foot care for you. Is that okay? Very good. Okay. So the skill require number one, hand hygiene. Hand sanitizing. Okay? I do hand sanitizing. I clean my hand with hand sanitizing. Number two, explain the procedure. I already did, but that's okay. Mrs. Johnson, I'm going to do foot care for you on one foot. Okay? Very good. Number three, get some warm water. Fill the basin. Mette un petit d'eau chaud dans ça, right? What's the temperature of the water?
105.
105. Température de l'eau c'est 105. I get some water, okay? And I bring it by, okay? Now, remove the so you can also test the temperature of the water with your hand. Ou ka tester si de l'eau est confortable avec main. Okay? Number four, okay, remove socks from the patient's foot. I remove the socks gently. Moi tirer chaussette là dans pied. Okay? Very good. All right. Number five, immerse the resident's foot in warm water. Mettez pieds passés dans de l'eau chaude. Okay? So, if it's on the floor or the bed, I get a bed protector under the resident's foot. Okay? And then I put my basin there and I soak and I put the patient's foot in it. Si patient que c'est atelier ou bien que c'est sous cabane lié, m'a mets ton bed protecteur en bas pied et puis m'a mette basin là sous lui, mets papier patient là-dedans. Okay? Verbalize the 5 to 20 minutes of soaking time. Okay? So repeat after me. I soak the foot. Repeat.
Soak the foot
For 10 to 20 minutes.
for 10 to 20 minutes.
One more time. I soak the foot
I soak the foot
for 10 to 20 minutes.
for 10 to 20 minutes.
Now, comme nous pas parler créole trop bien, faut me faire nous répéter en créole. Alright? Jean Gordon, repeat after me. Moins trempé,
Moins trempé,
pied patient.
pied brassant,
You're not repeating it, Jean. Come on now, work with me, darling. Alright? Moins trempé,
moins trempé,
pied patient.
pied patient,
Pour 10 à 20 minutes.
pour 10 à 20 minutes.
Very good. So you have to say that on the state exam. For 10 que trempé pied patient. Okay? Very good. Now, use water and a soapy cloth, washcloth, to wash the foot. Of course, with this procedure, I want to wear gloves. Okay? Avec procédure, ça ne pas dit m'obliger mettre gants, but c'est pire patient bral. Okay? This procedure doesn't mention that I have to wear gloves, but I can choose to wear gloves. No big deal. Okay? So, If you're doing the test and it's a mannequin, okay, no, it's okay. If it's a mannequin, don't worry about the gloves. You don't have to add it into it. Okay? Si c'est pied en man qui on va laver, ou pas besoin de tête de worry de gants. Okay? Because you want to save time. Okay? Time is important. Okay? So, I got my soap there. Okay? I got my washcloth. Number 6, use water and a soapy washcloth. I wet my washcloth, put towel, put soap on it. Okay? Number 7, wash the entire foot. Wash between the toes. Okay? Rinse entire foot, rinse between the toes, dry thoroughly. So, I need 2 washcloths. Moi besoin de 2 petites serviettes. Okay? 1 for washing, 1 for rinsing, so I keep my water clean. Okay? So, wash. So, what soap and water, I'm washing. Okay? I clean between the toes. Okay? While in the mitan zoteio. Okay? So I wash, do a little bit of scrubbing. Okay? And then a little bit of rinsing. Okay? New washcloth. Rinse the foot. Between the toes. The nails en bas orteil, underneath the toes. Okay? Put that aside. And then pat dry. Okay? Very good. Now, number 20, number 12, numéro 12, dry thoroughly between the toes. So, prends temps, bien prends son pour démontrer quoi sécher dans mes orteils. Take your time to demonstrate that you're drying between the toes thoroughly. Okay? All right. Very good. So I can put that aside. Okay? Number 13, apply lotion to the top and bottom of the foot. Okay? I got my lotion here. Lotion, top, bottom of the foot. Okay? Number 14, avoid getting lotion between the resident's toes. Évitez pour pas mettre crème dans mi-temps fond orteil. Okay? So toe, foot, top and bottom of the foot and the heel. En haut, en bas et talon pied. All right? Now, if excess lotion is on the foot, wipe with towel. Si vous mettez trop lotion, trop crème, essuyez cela avec serviette là. Okay? Number 16, replace socks. Right? Put the socks back on the resident's foot. Okay? Replace socks back on the resident's foot. What else? Rinse. So, rinse, dry, put away. Jeter de l'eau dans 5 là. So I throw that empty the water in the sink. Rinse, dry, put away. My towel, washcloth, my bed protector. Basically, I'm cleaning up. Okay? Everything go in my laundry hamper. Okay? Wet towels go in my laundry hamper. Okay? And I can remove my gloves, right? Place soil linen in the laundry hamper, did that. Number 19, perform hand hygiene, hand sanitizing, okay? And then I can do my finishing steps. Okay, Mrs. Johnson, I'm almost done. All right, your foot is very clean. Here's your core light, right? Let me remove the privacy, open the curtain, okay? I put the bed down, okay? So even if the steps does not mention the beginning and finishing steps, but you need to have it in your mind. Même si procédure là, Jean l'écrit a pas mentionné beginning avec finishing steps, faut gagner dans l'esprit. Make sense?
Yes.
Very good. So I put the bed down. So before I start, the bed goes up for proper body mechanic if the patient is in the bed. When I'm finished, bed goes down. One side well up, one side well down. I give the car light, make sure patient is comfortable, open the curtain, lock my bed. But moi si pas gon bagay m'blié. Let me see if there's anything I forgot. Very good. Okay, I am done with the skill. Thank you very much. Okay? Very simple, right guys? Very simple.
Yes.
Foot care. All right. Thank you.